Alrighty, so we are right at time, so I will go ahead and get us started. So thank you so much for joining us today for the National Environmental Public Health Internship Program informational session for our environmental health programs that are interested in becoming host sites. So on behalf of the National Environmental Health Association, I want to say thank you, and we are excited that you would like to learn more about the program and the possibility of becoming a NEPHIP host site for future interns. So just a quick note, if you are a student, you are more than welcome to stay on with us today, but please know that the information that we present today will be specific to host sites, and we will be hosting a separate student info session next Tuesday, the 24th, so you can register for that on the NEPHIP webpage. Alrighty, so today I am joined by my colleague Reem Tariq. She is a senior project coordinator at NEHA. My name is Adrienne Gothard. I am also a senior project coordinator with NEHA. So today we are excited to share information about NEPHIP, including details for applications, examples for intern independent projects and activities, and of course to answer any questions. So Reem is going to monitor the Q&A and the chat during our presentation, so feel free to ask any questions as we go, or you can save them until the end where we will have ample time for discussion and questions. All right, so let's get started. So we have three very important partners for this project. The first is our funding entity and primary partner, the Centers for Disease Control and Prevention's Water, Food, and Environmental Health Services branch. Our other partners include the National Environmental Health Science and Protection Accreditation Council, or EHAC. So NEPHIP is offered exclusively to students who are enrolled in environmental health programs that are accredited through EHAC. We also partner with the Association of Environmental Health Academic Programs, or AHAP. AHAP works to increase the environmental health workforce by promoting and supporting environmental health science degree programs that are accredited by EHAC. And then, of course, NEHA. So we have been facilitating this program since 2015. And so far, we have supported about 195 internship experiences across 110 environmental public health agencies in 38 states and territories. So through this program, NEPHIP interns are able to meet internship or practicum degree requirements, earn credit hours for required coursework, bolster their academic scholarship, and strengthen their work experience through completing their internship projects. So NEPHIP is a 400-hour paid internship that places environmental health students with host sites at state, tribal, local, and territorial environmental public health agencies. During their time in NEPHIP, students are exposed to the career opportunities, benefits, and challenges of working with environmental public health agencies throughout the U.S. As part of the program, we recruit qualified environmental health students who are eager to gain field experience, as well as recruiting environmental health programs that are interested in hosting interns. We then match them based on a variety of factors, including the student's experience and interest and the program's project portfolio. Additionally, we are prioritizing diversity and geographic representation in the selection process for students and environmental health programs. So next, I wanted to talk a little bit about the benefits for host sites. So first, qualified and compensated interns. So interns with NEPHIP are undergraduate or graduate students from environmental health programs that are accredited by EHAC, as I mentioned a few minutes ago. So EHAC accreditation requires a firm educational foundation in the natural sciences of biology, chemistry, physics, and geology. Each intern receives a base stipend. So our undergraduate students receive $6,000 and our graduate students receive $8,000 to complete their 400-hour internship. So stipends for interns will be provided by NEHA through generous funding from the CDC, and we facilitate these payments so no funding will have to pass through your department to pay the interns. Next is strengthening the profession. So the core aim of NEPHIP is to strengthen the EH workforce by bolstering incoming professionals with real-world experience at governmental, environmental, public health agencies. NEPHIP encourages EH students to consider careers at local, state, tribal, or territorial environmental health departments after graduation. So with 1 in 4 EH professionals in health departments planning to retire in the next 5 years, we know that creating a path for a next generation is critical. In a survey of former NEPHIP interns, 4 out of 5 said that they were more likely to pursue a career in EH after participating in NEPHIP. So this practical hands-on internship results in graduates that are well prepared to immediately enter the workforce or continue on with their academic journeys. And your participation helps to build qualified applicant pipelines into governmental environmental health programs. So next, I want to talk a little bit about the eligibility to be considered as a host. So to be considered as a host program, the environmental health program should have the ability to meet the following criteria. So number 1, have the ability to assist the student in identifying and completing an independent project. So this project will focus on solving a current environmental health problem or challenge that's facing your jurisdiction. So project topics can vary across all environmental health services and topic areas. However, we do encourage programs and interns to think about a few things when they're doing their project. So one is, considering how climate change can impact environmental health. And the other is to identify environmental justice and health equity concerns as they relate to the project. So we will be prioritizing strong health department applications with projects related to climate health, environmental justice, and health equity. So this project can, 1, help your departments reinvigorate projects or programs that may have been impacted by competing priorities, and it can be used by the intern to meet their university internship requirements. Along with the independent project, we require the intern to produce a deliverable that's associated with their project. So this is really, the natural output of whatever project you have them working on. So perhaps you have them doing research for a certain issue that's affecting your communities. Their deliverable could then be a report or a presentation to your team on what they found. If you're having them work on community engagement or education, it could be something that they create for your website or social media. So again, really whatever is the natural output of the project that you have them working on. And we will ask interns to submit a copy of their deliverable or deliverables, because there could be multiple, to NEHA at the end of the internship. So we'll share some project and deliverable examples here in a few minutes. The next thing that we ask of host sites is that they're able to provide opportunities for student interns to be exposed to various programs, activities, and services that are operated by the department or program, just to support their knowledge of various environmental health services and topic areas. So examples could include climate and health, food safety, on-site water and wastewater programs, vector control, or emergency preparedness. So you could expose the students in, shadowing with inspectors or having informational meetings with other EH departments. And really the goal with this is just a well-rounded experience that results in the students' understanding of the important work that environmental health programs do. So during their time with you, interns are going to be, 1, working on this independent project, and 2, having these other opportunities to see, again, the important work of your department. And then finally, we ask that each host site assign a primary mentor to the intern, who should be available to assist in mentoring and advising the student during their independent project and on a routine basis throughout their internship. So we realize that there will likely be many individuals involved in the mentoring of the intern during their time with you, but we ask if there's a primary mentor who will be the individual that we coordinate with throughout the internship. All right, so talking a little bit about the application, you can access the host site application and all of our supplemental materials on the NEPHIP website, which is linked here. But I just wanted to let you know some of the things that you'll be finding on the application and that you'll be asked on there. So on the online application, you'll be asked several questions about your program. So things like contact information, location, number of staff, etc. We will also ask you to briefly describe, the types of opportunities that are going to be available to an intern that works with your program. So for example, would they be able to shadow with pool inspectors or food inspectors? Would they have learning opportunities with your lead or vector control programs? Would they be able to participate in your climate and health working group meetings? So we just ask you to list things like that they would have access to during their time with you. And then additionally, you'll be asked to identify any independent projects that could be worked on by the intern and how those focus on sustainability, climate and health, environmental justice, and health equity. All right, so now I am going to pass it over to Reem to share a few examples of past intern projects and deliverables. So Reem has the unique perspective of being a past NEPHIP intern. So she's going to share a bit about her experience. So Reem, go ahead and take it away.
Thanks, Adrienne. Hi, everyone. Like Adrienne mentioned, I will be sharing some information on projects that our past interns have worked on to give you an idea of what an independent project and a deliverable might look like. And like Adrienne also mentioned, I actually started my journey at NEHA as a NEPHIP intern. I interned at the Benton County Health Services in Corvallis, Oregon, back in 2017. And my independent project focused on determining the efficacy of food manager certification at improving food handling practices through a literature review and an observational study. The objective of the observational study that I conducted was to explore the association between the presence of a certified food manager and the overall inspection score or a number of critical violations at a given food establishment in Benton County. And my deliverable for this project was to develop a report on this topic and share it with the Board of Health at Benton County Health Services. But besides my independent project, I also worked on some other smaller projects. And I developed a variety of resources at Benton County. For instance, I got to develop a recreational campground inspection checklist, and I also got to participate in the emergency preparedness team at Benton County as they prepared for an influx of about 100,000 people coming into the county for the total solar eclipse event back in 2017. And I've included a photo of that with my supervisors that I took back when I was completing my internship on the slide up here. Just to provide another example, one of our another in-person summer interns from 2017 was matched with the Tennessee Department of Health. Her project for the internship was to develop an online survey that gathered feedback from local foodborne outbreak investigators about CDC's NEARS program, which stands for the National Environmental Assessment Reporting System. The goal of the survey was to assess knowledge gaps, identify training needs, and understand perceptions of the tool. In addition, she assisted in investigation of a possible foodborne disease outbreak and helped with testing drinking water facilities and private spring water for potential harmful algal blooms. She also shadowed on pool inspections for the county health department and even got to observe a consultation for a tattoo parlor. At the end of her internship, she said that she had a variety of field experiences and she enjoyed all of them, and she could see herself working at a local or a state health department. Another example from our virtual intern from 2022, this person worked with the public health preparedness team within the South Carolina Department of Health and Environmental Control. His independent project was to create an evaluation for emergency medical needs shelters. He designed a strategic evaluation system for shelter sites with respect to both health equity and shelter operational factors. The goal of the project was to help public health officials decide which medical need shelters to activate when a disaster struck. His project deliverables were developing an evaluation tool. So the tool itself was a deliverable, as well as a report outlining detailed instructions for using the said tool. He had this to say about his project. He said, "What I learned is that environmental health plays a huge role in activation management of medical needs shelters, a much bigger role than I initially suspected. Storm safety for shelters and staff, maintenance of evacuation routes, and having those high quality feeding options are all operational factors that have strong roots in environmental health industry." So that's good. That's another, one of our goals for NEPHIP is for our interns to get insights on what the environmental health field includes. Another example from a virtual intern, also from summer 2022, this person interned at the Denver Department of Public Health and Environment. The independent project was to compare food safety violations and enteric disease cases with socioeconomic variables like race and education using ArcGIS, with the goal to further understand and identify potential food safety burdens or disparities. All of this, of course, was relevant to Denver. The final deliverable for the project was a presentation of the maps and the data that was collected from the literature review to a group of 45 public health professionals within the department. The picture up on the slide is one of the maps that was created for the presentation. So the team at the Denver Department of Health took a unique approach to creating a well-rounded experience for virtual interns by having multiple departments present to them about what they do for the city. And their intern had this to say about their experience. They said, "I expected to see water and air quality teams telling us about their work, but there were other ones like medical examiner and the animal protection department. When I hear environmental health, I think of stuff literally having to do with the environment. So it was really nice to be able to see how much their work really encompasses." And the last example that I'd like to include is coming from a fall 2022 intern that was placed at the New Orleans Health Department. Her mentor was a climate and health officer within the department, and this intern's independent project was to research how communities of color are disproportionately affected by climate change when they live in close proximity to pollution sites. This work resulted in her deliverable of a story map of a case study from New Orleans neighborhood that will eventually be published on the department's website. In addition, this host site chose to use their support package funds to purchase a tablet that was used by the inspectors to allow the virtual intern to be able to shadow health and safety inspections. If you would like to get some further ideas for independent projects, I will be dropping a link in the chat, which will provide some further guidance. And with that, Adrian, I'll turn it over to you.
Awesome. Thank you, Reem. All righty. So we are currently in the process of recruiting for the summer 2023 session. Student applications opened on January 9th and will close on February 1st. And while there's no deadline for host site applications, we do encourage you to submit your applications by early February for priority consideration for a summer 2023 intern. And just so you know, we do leave the application for host departments open year-round. So if you had previously submitted an application and selected that you were also interested in a summer intern, your application will be considered for summer 2023 if that's what you selected. In terms of notifications, the selection and matching process will take place in February and March, and notifications for the selected summer host sites will be sent out by early April. So start and end dates, summer internships will be 10 consecutive weeks, starting anytime after May 22nd of this year, and they will need to wrap up by the 1st of September at the latest. So just to note that some of the qualifying EHAC programs run on quarters instead of semesters. So if you are matched with an intern from one of these schools, they may not be done with classes until June, and may not be able to start the internship experience until mid to late June. But that should still allow you time to fit in the 10 weeks before September. All right. And as I wrap up the presentation here, I just want to take a minute to talk about what host sites can expect if they are selected. So once accepted, interns and host sites will be asked to confirm their intent to participate for the summer 2023 session. And after that time, you'll be introduced to your intern via email. And then starting from there, host sites and interns can begin to make arrangements. So for interns who are relocating to the location of their host site, this would be a good time to start talking about, of course, start and end dates. We do ask that hosts provide ideas for housing if possible. So that would happen, like I said, in early April is when you could start contacting your intern. As far as paperwork goes, selected host sites will be asked to fill out an agreement form with NEHA. So this is just a really simple form where we, outline the details of the program and just kind of ask you to confirm that you agree with that and you understand what we're asking for with the internship. And then additionally, interns will connect with you if they have some administrative paperwork that's required for their academic institution. And please note that all students are required to pass a background check prior to starting the internship experience. And while we will share the result with you, we cannot share the actual documentation for the background check for privacy reasons. So that may be something you might want to check if you haven't hosted it. A NEPHIP intern before, if you all will need to run your own background check or not. I know some departments have needed to do this, even though we also do it. And then several weeks before the internships begin, we will host orientations for all participating interns and host sites to go over the details of the program. And then NEHA's involvement. So as I mentioned, the student intern and the health department will be making all of the arrangements for the internship. But throughout the internship, NEHA staff is available to help support both interns and programs as needed. Before the internship starts, we do provide a work plan template that can help interns and mentors to identify project details, deliverables, timelines, as well as any trainings, tools, or resources that may be needed. And throughout the internship, we will be sending out short check-in forms weekly to both interns and mentors to help identify any needs. And we will be setting up separate mid-internship meetings with interns and mentors to discuss project progress and performance. And then at the conclusion of the internship, the intern will be required to give a short presentation to NEHA staff to describe their experience, highlight their independent project outcomes, share what they learned, things like that. So host site mentors are welcome to attend that presentation as well. Alrighty, so I actually need to jump back because I think I may have skipped a slide in here. I don't know, Reem, did you notice? I don't know. Let me see here. Did I talk about the support package here?
I think you might have skipped that.
I think I might have skipped that. I apologize, everybody. Yep, I stopped right after strengthening the profession. So we'll just go back here for a second. So along with support and coordination, so we are now able to offer host sites a support package valued at up to $1,500 per student to help compensate for intern-related costs. So examples could include, say your program wanted to purchase a laptop or a desktop computer for the intern to use during their time with you, and then of course you would retain it after they are done. as Reem mentioned with one of our recent virtual matches, they purchased an iPad so that the intern could, go on virtual inspections with them. This could be used for training and educational resources for the intern. So if there's some sort of training that you would like them to do before they start in on their independent project, and that has a cost associated with it, that is something we'd be happy to help reimburse. If your program needs a certain type of software, so if you need Microsoft Office licenses or a Zoom license, or access to a database or GIS license, these are all things that we would be happy to use this support package for. It is a reimbursement process, so you would purchase the item and then submit an invoice to us for reimbursement. And I'm happy to answer any questions, about items that you could think of, and we'll let you know if that's something that that those funds can be used for. All right, and then flexibility. So NEPHIP now supports 50 internships throughout the year, and we offer summer, spring, and fall sessions for flexibility for students and for environmental health programs. Within recent years and in response to the COVID-19 pandemic, NEPHIP introduced a virtual format. However, we are now back to being able to offer fully in-person and hybrid internship formats as well. So a hybrid would consist of this is the student being in person for a portion of the internship and virtual for the other portion. So one thing that you can expect to see on our application is we do ask what format you are interested in hosting an intern for. You can, indicate that you're looking for a fully in-person intern, that you would be able to host a fully virtual intern, or that you'd be open to any of those formats. Okay, all right. Well, I think I got everything in the presentation now. So we will go ahead and open it up for questions, and I will put it on this last screen here just so that you all have our email. Email us at any time at nephip@neha.org. All right, so let's look at some of these questions. So we do have one question here. Are the 400 hours consecutive, i.e. 10 weeks of 8 hours a day, 5 days per week, or are they part-time hours for a longer duration of time? So great question. During the summer, when students are not in their traditional classes, we do say that the internship is the 10 weeks full-time, so 40 hours a week, like you mentioned, 8 hours a day for 5 days a week for that summer session. Now, when we do our fall and our spring sessions, we are offering a little bit more flexibility in time, just knowing that those students are likely also, they also have some other coursework to do. But during the summer, you're correct, it is the 10 weeks, 40 hours a week. And of course, like I mentioned, we leave it up to the health department and the student to kind of determine start and end dates. And, if you're willing to be flexible, so say they have a day that they needed off during the summer, or if your department's going to be closed, or if you're going to be on vacation for a certain amount of time, you'd be able to, flex a little bit around that. And then the second question here was, can you expand on the requirements for mentors? Do they need to have any educational qualifications? That is a great question. Well, they will have to work for a state, local, tribal, or territorial environmental public health agency. That will be one of the requirements. Reem, have we in the past had any requirements for the mentors?
We haven't had any hard and fast requirements for the mentors. I guess it would be nice if the mentor has an REHS. That always helps. And in the past, we used to not require, but perhaps recommend something for the environmental health program as a whole, which is the BHAB accreditation. But none of these are hard and fast requirements. So it's a good thing to have. And we strongly recommend environmental health programs to have those, but not having any of these is not going to disqualify you, if that makes sense.
Thanks, Reem. All right, we have another question in here. Will this year be in person or virtual? This question may have been asked before I went back to the slide that I missed, but we have options for virtual, in-person, or hybrid going forward with every session. All right. Thank you, Reem, for adding those links in the chat there. Let's see, do you have a document that lists all the application questions? You can't save draft responses in the Microsoft form to return to later. That's a great question, Maggie. Thank you so much for that. I'm happy to put together a PDF of the questions and send those out to you all so that you have them so you can prepare your answers in advance. Thank you. And then we had another question here. Are there any deliverables required by the host or just the intern? Great question. So, as I mentioned, there are a couple things that we ask hosts be able to provide for the intern, one being that independent project and the other being, opportunities to shadow and experience other areas of EH. The intern will have, of course, have their deliverable to turn in at the end to NEHA and their final presentation. But really, there aren't any deliverables for the host. We do, as I mentioned, send out a weekly check-in form that we ask the primary mentor to fill out to help us, just make sure that things are going well. That's a very quick, 4 or 5 question Microsoft form. And then we have that mid-internship meeting. But other than that, there are no deliverables required of the host. Right. Is there a list of past projects students have participated in on the website? So we don't have a list of all of the past projects. We do have a project guidance document that can give you some ideas. And additionally, we're happy to help brainstorm if you want to send us an email and let us know what you're kind of thinking. We're happy to help brainstorm for ideas for projects. Are projects typically chosen by the host, intern, or both? If both, when does the back and forth ideally happen? This is a great question. So as I mentioned on the health department, the host site application, we do ask you to kind of identify some project ideas that you have in mind. And some departments have, a project that they definitely want an intern to work on, and some it's a little bit more flexible. So there isn't a hard and fast answer to this question, but I would say that when you're first matched with your intern and you're introducing yourselves, I would say if there is some flexibility, kind of talking to them about what their interests are, what their experience is in, and seeing if any of your projects would fit with that. But like I said, if you do have a project that you need worked on, so for example, we've had some health departments that apply for a NEPHIP intern because they know they need help with their voluntary retail standards program. And so in that case, we would let the intern know, hey, you've been matched with this location, and then this is their proposed project. But like I said, if you do start to have those conversations with students, we've had other health departments that have, they maybe had a project in mind originally, but once they started talking to their intern and seeing what their interests were and their experience were, it kind of pivoted and grew from there. So great question.
I think the next question, Adrian, is do you have other examples of projects not at local health departments? So I'm guessing like state, tribal, and territorial specifically.
That's a great
Yeah,
question. Do you have any examples off the top of your head, Reem?
I think I included one. The second example that I talked about was at the Tennessee State Department of Health. And that was on the MIRS program. Again, a survey was developed, which was to assess the knowledge gaps, identify training needs, and understand the perceptions of the MIRS tool. So absolutely, with, if it's a state, local, territorial, or tribal environmental health program, you can most definitely propose projects that do have an environmental health focus. I don't know that there is a specific difference in terms of like state health department, proposal ideas versus any of the others. I don't think so.
I would agree. Yeah, I'm trying to think back to our past couple internships sessions. I know over the summer we had a couple interns who were working for the Alabama environmental public health department, and some of their projects were to create educational resources for kiddos who to kind of introduce them to things such as food safety and basic septic system care. So they were creating really cool things like coloring books for these kiddos. So I think, there are lots of different ideas. So kind of maybe just start with thinking about something that your department has been thinking about, or you just don't have the resources to dedicate to that project. And that might be a good place to start. All right. Let's see. You mentioned the retail food program standards. Assistance with this program could be a possible project. Yes, definitely. So, having the intern work with food safety and helping you with your retail standards. I think that's a great project. That is one where we have had to get a little bit more creative when thinking about, how can we really incorporate those themes of environmental justice or health equity. But some of the things that we've talked with interns about is, when you're thinking about these standards and you're thinking about food safety inspections, thinking about the community that you're in and what are the languages that are used, for things like inspection reports and education. So, I think there are ways to bring in those themes to any kind of project that you propose. So yes, great question. Retail food program standards would be one that you could use an intern's help with. And then of course, so say that's their independent project, then of course you can give them exposure to all of these other wonderful areas of environmental health as well.
Adrian, I think Rob had a question.
Yes.
He asked, do you prefer climate and health, environmental justice, health equity opportunities, and why so? Is there any room for other EH disciplines to be explored as an independent project?
Yeah, definitely. So, like I mentioned, these independent projects can be across any environmental health discipline. I think we're just really trying to focus on climate and health, environmental justice and health equity, and weaving those pieces into your project, just because, we do see that those are future areas that the environmental health field really wants to make sure that we're considering. Reem, do you have anything to add to that?
I think you covered it. You're not bound to these focus areas, and there could most certainly be overlap. I think I shared an example of one of the projects that was focused on food safety, but also explored elements of health disparities. We encourage projects like that, but to propose a project outside of that, is not going to disqualify you. You're more than welcome to include a variety of projects, as long as they've got an environmental health focus, yes.
All right, I hope I'm not missing any here.
There's one more question. It's an interesting one. Is this program open to retirees who have worked in the environmental health field?
So I think the answer to that would be the interns would need to be associated with a state, local, tribal, or territorial health department. So maybe someone who is a retiree who is working on a project that's not associated with a governmental public health agency would not be considered. I think that was what the question was answering or asking, excuse me. It looks like we have another question here. Is purchasing them a laptop with the support package expected, or is it acceptable to ask them to use their own if none are available? That's a great question. So, you know, obviously our virtual interns are all going to have their own laptop that they can use for the duration of the internship. If the intern is coming to you in person, you wouldn't need to use those funds for a laptop, but I think that would just be a conversation with the intern if they felt comfortable using their own equipment. I think a lot of times the question of you know, access and security comes up. So I know several of our previous host sites have chosen to provide the intern with a laptop just because then it can be preloaded with all of the, you know, the materials that they need or the access that they need. But no, that is not expected that you use the support package for a laptop. All right. So we have another one here. Oh,